Thank you, Dr. Pantep, for a great introduction to One Health for All, our zoo personnel. I'd like to continue from Dr. Pantep's discussion on One Health, specifically dealing with what zoo as an institution can do towards One Health. As you can see from this diagram, that in order to really do a holistic conservation program, we need to not only take care of animals, but also the environment and humans, or else if the environment is not good enough for the animals or us to live, then why would we conserve? And if the humans, both the zookeepers and the visitors, are not healthy, then our animals might become sick and there might not be any staff to take care of the animals, or the zoo tourists might become sick from our animals. So all these factors must come together in order to effectively do conservation. But with the increase of population around the world and more intensive farming leading to deforestation, more people coming to live into the city closely together with urbanization, and so there are more opportunities for pathogens and diseases to spread. And with deforestation and the roads leading into the forest, it leads to fragmentation, which I'm sure zoo professionals are aware of, biodiversity loss and also inbreeding. Well, on the health side, there are also factors from fragmentation in that it leads new diseases to come out of the forest into the fields and into the city, and also new diseases from humans who go as tourists into pristine forest areas might be spreading new disease into our local forests. And not only locally, but transportation is now international across boundaries. And the wildlife trade is also one factor, which even though you're staying at home in the city, but if you consume wildlife, which is mostly unprotected, which is mostly illegal, and so these animals are mostly not well taken care of, and many of them are wild caught. This could lead to infection of many new diseases, which are hard to diagnose. And for wildlife, there are also problems of the pet trade. This is also many times illegal, and so these animals come into the country without any quarantine or any health care. And this is a big problem because these animals come from a different environment, and when they are closely packed together in tight quarters, many would die and spread the disease inside the cage. And once the animals are sold to our local people, then the new disease from foreign countries can spread to our animals. This map shows the global map of emerging infectious disease from the 1940s to 2004. You could see that most of the new diseases discovered are around closely populated areas and also along the ports and main transportation routes. And these are some of the diseases which are becoming newly emerging infectious diseases around the world. And the ones with the stars are zoonotic. And it has been shown that over 60% of newly emerging infectious diseases are zoonotic, meaning it can be transmitted between humans and animals. And of these 60%, over 70% are from wildlife origins. And so it's very important that we take good care of our animals, our staff, and be aware of possible diseases from wildlife. Now, I'm going to tell you of an example of what we've been doing of the zoo's role in diagnostics. This is a story about West Nile virus. It started out along the Nile River Valley, but eventually it spread across Africa and Europe. And then in 1999, people in New York, United States, started becoming ill and died. At the same time, a month or two later, the crows and flamingos in the Bronx Zoo also began to become infected and die. And so from this beginning, at first the medical doctors were not aware of West Nile virus because it's a new disease and it has never been reported in North America. And so they were diagnosing from the symptoms of febrile illness and encephalitis and thinking of other common illness in the United States. But the actual diagnosis of West Nile virus was done by a pathologist, a zoo pathologist at Bronx Zoo. And the diagnosis came from the crows in the Bronx. And from this first diagnosis of West Nile in America in September 1999, it became clear that both the infections of humans and animals were of the same disease. And so this demonstrates that a zoo veterinarian, zoo pathologist who is aware and does a clear, true diagnostic of animal deaths in the zoo, we can help contribute in diagnosing new diseases, which medical doctors might not be aware of. So West Nile virus started in 1999 in the US. The blue dots are non-human West Nile virus, mostly in birds, and the red dots are in humans. And this would show that the virus spreads yearly, and it starts spreading with animals first. The first case would be from animals, mostly birds, and then the human deaths and cases would follow. And so you would see that now 2004, it has spread to the West Coast and all over North America. And so it's very hard to control diseases. For West Nile virus, the vector is a mosquito, which is native to Africa, and it's believed that this mosquito jumped on a ship, maybe in some container or some used tire, and spread in North America. And it's becoming nearer and nearer to us. West Nile virus has now spread to Assam, India, and this was just 4 months ago. And so we, as CIASA members, must be aware of newly emerging diseases which might spread to our region. And so we started exploring what we can do towards One Health. And one thing is getting together with other professionals, because in order to properly conduct a One Health research or program, we need experts. Like in this workshop, Animal-Human Environmental Interface workshop from a year ago, there were both medical doctors, livestock veterinarians, wildlife experts, epidemiologists, communication experts, and socioeconomists, all together to analyze what we can do for One Health. And in this zoo seminar, SUPIO also has an annual seminar of new findings on zoo research and management. And last year when we had the seminar, you would see Dr. Bantep to your left, top, and Dr. Boripat to your right. And in the middle, the two doctors are, one is from the university and the other is from the Ministry of Public Health. And the third doctor with a black suit is from the livestock department. And so you would see that even though we are mainly focusing on wildlife as a zoo, but our expertise is very valuable. Livestock veterinarians are not familiar with many of our wildlife. And our medical doctors are not aware of many of these diseases. And so it's very important as a veterinarian in the zoo to be aware and help in One Health by collaborating with universities and medical doctors. On the bottom is our conference with our Laotian friends at Luang Prabang. And so I'm going to tell you about what specifically we've done towards One Health in Setio. And as a star animal of many of us is the elephant. And the elephant has been diagnosed with tuberculosis in many countries. And it's very hard to treat in that diagnosing elephants are difficult because we can't do a good chest x-ray of the elephant's lung because it's so big. And we can't do a proper skin tuberculin test because the skin is too thick. And so the proper diagnostic tool is through a trunk wash. But for elephants, the problem is that when the mahouts are taking care of the elephants very closely and living together, which could possibly transmit the disease between humans and animals. And so we started our research at Surin Elephant Kingdom. Our research was done in both humans and animals. For humans, we contacted the Ministry of Public Health to help diagnose humans by doing chest x-rays. The bus you see there is a chest x-ray bus. And for elephants, we did serum sampling and elephant trunk wash. Results showed that for the mahout families, all were negative for tuberculosis. For the mahouts, over 12% of our staff were positive for TB, of which 100% were males and 57 years old was the median age. And of these 14 cases, 9 were new cases which were never diagnosed before. And so if we had not done these chest x-rays, they might not have been diagnosed. For the elephants, we did a rapid test and found 29% were positive. And we did a further test of direct PCR through trunk wash and blood cultures. For the trunk wash, it must be continuously done every 3 months for a 2-year period. And luckily, only non-tuberculous were found. And so of the positive ones, it was not an infectious tuberculosis which could spread to humans. And so it's important that we must be aware of both human health, wildlife health, and animal health. And for just this one program, we had the cooperation of these 10 institutions on both human side, both wildlife side, and animal side. And it came through the collaboration with universities, with hospitals, and with livestock department. And we further developed the Elephant TB Task Force of Thailand. And so this initiative was to do further research in preventing and treatment of tuberculosis in between animals and humans. And so we had collaborations of all parties, as said. Another topic of our research was, does flu transmit between animals and humans? In which cheetahs in the US were shown to be infected with H1N1. And so we conducted our research in 4 sites, 2 in the Central Plains and 2 in the South. So for the humans, we did questionnaires and blood sampling. And for animals, we swabbed for H5N1. We found that 61% of our staff had acute respiratory illness, and 13% tested positive for H1N1, but none were positive for H5N1. And we sampled over 500 animals. Of the animals, 2 of our tigers were positive for H1N1, and we found that the 2 tigers were paternal relationship between mother and son, and the zookeeper who were positive for H1N1 was the zookeeper of the tiger. And so there are high possibility of establishing an integrated human-animal model for early detection of zoonosis and in the zoos and wildlife breeding centers. And this outcome directly helps the zoo by encouraging better occupational health of staff. What we have done is we have vaccinated our zookeeper staff for flu. We have established first aid room for staff to rest while having illness, and we have established training routine for staff to be aware of zoonotic diseases and symptoms in both humans and animals. And I would like to present the last slide that it's not only West Nile or TB or H1N1. There are also other illnesses like herpes, hepatitis, brucellosis, toxoplasma, or even rabies and tetanus that we should be aware of, whether our zookeeper staff are vaccinated or not. And we have established a website, wildlifehealthnetwork.org, and these are all the people who have helped in this program, and especially I'd like to thank our CFPO veterinarians for the sampling and help. Thank you.